Hey guys, my name is Julianne and I'm here to talk about Nightingale and the patterns of knowing. And I got all my information from the book and the sources that are linked with our module 1. So, two basic concepts that I see in Nightingale's work include environment and that nursing is a science and an art. Say environment because Nightingale focused on physical environment, including making sure patients had ventilation in their rooms and in their homes, if we're talking about a large environment. And she emphasized on providing simple things such as light, cleanliness, food, and attention to interpersonal needs. Nursing is both a science and an art because she focused at that we have this, as nurses, we have the science part because we treat patient illnesses and we need to understand the medicine behind it to be able to follow physicians' orders. But also, we are not just looking at an illness, we are treating a person and we are treating this person as a whole, holistic approach. And nurses need to also bring the art side, which is the compassion side and taking care of patients' needs, even if it's something as simple as bathing and cleanliness of the patient, which promotes patient recovery. When I think about 3 significant contributions to modern nursing made by Nightingale's work that still resonate in modern nursing practice, I think about her holistic care and patient-centeredness as my first one because her understanding that patients are not just their illness, but individuals with emotional, psychological, and social needs remains a foundation in today's practice. And as advanced practice nurses or research or clinical nurse specialists, and nurses in general, we need to embody this holistic approach of looking at the person as a whole and consider the patient's physical, emotional, and cultural dimensions to best provide care. A second significant contribution, I would say, would be evidence-based practice because Nightingale's commitment to data collection, analysis, and the use of evidence to guide nursing practice laid the foundation for evidence-based nursing care. And she used statistics to demonstrate the impact of nursing interventions in patient outcome, which is similar to what we see today in advanced practice nursing, which relies on current research findings to make the best clinical decisions based on the best evidence available. A third contribution I would say would be infection control and hygiene, which is crucial for patient care, but her emphasis in maintaining a clean and sanitary environment to prevent infection and diseases greatly influenced modern nursing practice because this is something we have to do with every patient. We make sure that everything is sanitary and this helps improve patient outcomes. When I think about a time, a clinical experience that I've experienced a non-empirical pattern of knowing, I think about this patient I was helping my nurse with. I was in clinical as a nursing student, and this patient had cancer that had spread all over his body, and the nurse provided a PCA pump for pain as long as other pain medications, but nothing was controlling his pain. And he was there with his parents, and the nurse and I just helped providing support. We were emphasizing with the patient's emotional journey and providing support to both the patient and the parent. And I would classify this as a personal knowing example of a pattern of knowing nursing. For the question that says, how was a non-empirical pattern of knowing key in understanding a patient's needs to improve patient outcome? I would also talk about personal knowing because understanding the patient's personal history preferences, values, and emotions allows healthcare providers to tailor their care to the patient's individual needs. And this helps create a strong relationship between the healthcare team and the patient, which leads to trust and better communication, because when the patient feels that they are understood and valued as an individual, they will most likely engage in their care, follow treatment plans, and overall have better healthcare outcomes. And then lastly, how does Nightingale's work and the patterns of knowing inform the work of nurses today? I would say they go hand in hand. Both Nightingale and the patterns of knowing have come together today to form what it is the nursing process and how we as nurses take care of patients using ADPI, the assessment, diagnosis, planning, intervention, and evaluation. I think both of these come together to really form the core of what nursing is. Thank you.